some of the what I would call the next level up roles in both higher education and the NHS are accessible to women. You know, absolutely are accessible to women. It's when you then get to the next level up after that that there seems to be some form of barrier, you know, some form of reason why you can't access that. And I think we can liken that, can't we, to you won't keep knocking on the door if you know you're never going to be let in. And I think it's really important for women to come together and recognise that, yes, you're entitled to go and do that. You're entitled to move up that ladder. And if need be, I love your analogy, let's climb through the window together. Yeah, you know, let's climb through the window and let everybody know we're here and we've got something to bring to the table. And I think it's that often is the blocker, is that self-doubt sometimes, isn't it? That you haven't got anything to bring to the table.
Yeah.
But we have got stuff to bring to the table. We must bring it to the table. And if we have to climb through the window, we have to climb through the window. We shouldn't. We should be let in through the front door. But if need be, I certainly am going to climb through the window, and I'm hoping Judith is going to be next to me. And I think it's that, you know, I've seen it in all of my career, and I do think I feel very proud to have trained when I did in nursing, because I came to nursing after my first degree, actually, and so I am part of what was called a Project 2000 generation. Apparently we weren't going to be good nurses at all. Everybody was really horrified about our training, but actually it turned out we were all right. And I do feel really proud that actually as part of my training at Kingston, even back then, it was instilled in us that we could rise. You know, we did have skills to bring to the table. And I think it's important to be very vocal about that and to have things recognised. And I think that Kingston University has some really great initiatives around women in education and supporting women to really do well. And it was really interesting. I did the Beyond the Barriers, which was through Kingston University, and it was really interesting speaking to one of my male counterpart who was a mentor on that programme. And he said to me, you know, what is it that you want? And I said, you know, I want X, Y, and Z as part of my career. And he's like, well, have you sat down and told someone that? I was like, oh, no. Oh, no, I haven't done that. You know, and he's like, well, then how's anyone going to know if you don't tell them what you want? And for some reason, I had that block. And for him, it was just really clear. You just sit down and you say, this is what I want. This is where I want to be. Please help me get there. And for me, I think whether it's about being a woman, but also about being a nurse, I'm all about the teamwork and I'm all about making sure everybody gets there. You know, I couldn't possibly think about sitting down and saying with any of my senior leaders and saying, this is what I want. But that's my barrier, isn't it? And it's how do we lift that for women? So we think more like that man who said to me, just do it. For him, it was no question. And that really resonated with me. I don't know if you've had any experiences like that, Judith.
Well, yeah, I think, I suppose I probably, for me, I think it's probably the cultural elements and the expectations on top of that as being a woman. You know, what does your culture expect of you? And so you've got the upbringing and, you know, whether or not, I think it doesn't actually matter which culture you're in. There's elements about expectations of behaviour, isn't there, and where you sit. And as a woman, I think sometimes, you know, there's a tendency to want to push us into the home. You know, that's where we sit in the home, and you know, and then how do we sit in the workplace? And you know, are we becoming, you know, what are we becoming like if we're taking senior roles? So there's a whole sort of levels of I guess expectations of women, and even some of the terminology that they use for women in leadership roles, you know, it's sort of quite negative. So if we are assertive, then we probably get labelled with something completely different to that of sort of a man's sort of reaction. So I guess there's I suppose, you know, if we're thinking about it, it's accepting that those things are there and we're not going to change a whole world, but we shouldn't stop ourselves from moving forward, you know, and I guess you just have to accept that you will meet that, you know, and you know, that you won't get a nice clear pathway, and that you will have, you know, be having to do some headbutting to get where you want to be. But I thinking about, you know, what's the support mechanisms, And I guess having networks, you know, so and places where you can get support, I think, so that you can be renewed. So, you know, so it will always be a battle. Well, hopefully sometimes it maybe at some point it won't be, but actually having those renewal spaces are, I think, are important, I would say, on people's journeys.